Hello, I'm Dr Gandhi and I'm a GP partner at Wellspring Surgery, and I'm also Clinical Director of Nottingham City East Primary Care Network along with Dr Margaret Abbott, and we work as part of our team covering basically the inner city area of Nottingham, including various parts going from St Anne's to Sneinton to Carlton to other parts of it, including all the way up to Mapperley and Bakersfield. We cover 7 practices in total, and in this part I'm just going to cover the various different things our network has been trying to do over the past couple of years and what we hope to do in the near future to try and serve our population hopefully a little bit more effectively. I'm not going to focus on the additional roles that we have, that's been covered in a separate session, but in this one we're talking about that extra stuff that we are looking at doing, and some of that will actually include the way that the roles work. So I'm just going to transfer us over to a couple of slides just to help explain some of this for you. So as I said, this is the innovation aspects of what Nottingham City East is hoping to achieve in the near future. In terms of what we're doing for that, well, let's have a look, shall we? The first part we wanted to talk about was that over the past particularly year or so, we've been increasingly having a project with small steps, big changes, and this is looking at helping newly pregnant women, and particularly those families that are, trying to understand how to, increase their family and what that means for them themselves. Is in particular working with those patients with communication challenges, so non-English speaking, and supporting them and understanding their needs to try and helpfully target the kind of support that they're going to need. And we're doing this in collaboration, as I said, with the Small Steps Big Changes organisation, and it's been work that hopefully we'll see the fruition of that information come through shortly. In addition, because of the challenges that many of us have with activity, we've been working along with Park Run Group to try and facilitate how this can help from our practices. A couple of our practices have engaged by going to the local park run, so the closest one to us is the Colic Park Run, and we've even explored possibly setting up our own one across the Nottingham City area. Hopefully we'll see even more of this, but regularly members of our practice attend the Colic Park Run to help facilitate that engagement for patients, and keen that we can advertise and encourage them to engage in that even more. And more recently, a project that we will hopefully see real fruition for in the near future is we're looking at helping to educate our patients about the different ways that they can use our services. In particular, we're working with the Refugee Forum to basically establish how patients can use our practices more effectively. Particularly for those with language challenges, so we're creating video-based information that can be shared with these patients in their own languages to show them how to do various different things. So simple things that many of us kind of take for granted: how to register with your GP, how to get an appointment at your practice, how to ask for a visit, all those kind of things that actually we assume people know, but they may not know, because actually healthcare, as we know, changes so rapidly and every practice is different, but there are similarities that go across. So this information, this media that we hope will be personalised to our area, particularly to support those patients who don't speak English. They will be available in English. They look awesome, so look out for them. They'll be coming out on the Nottingham City East YouTube channel shortly, and hopefully you'll find that really useful to you and your patients. You're more than welcome to use that media as well. In addition, we've been doing some innovative stuff in our particular network. So we've been working locally with a pilot to look at the way that we fibroscan patients and how we can set that up more effectively in our local area. We are research ready, and including, we're doing research projects for the wider area to help understand the data metrics and how that can help our patients in terms of their healthcare. And we are piloting some really innovative use of our additional roles. So although I'm not focusing on them in detail, there are 2 parts that we wanted to highlight. So we are looking at having a pharmacist whose focus is going to be on those patients with mental health issues and learning disabilities, to target their medical needs, and particularly from a medication perspective, and how that can be looked at to encourage better healthcare for those patients. In addition, we piloted something called a safeguarding care coordinator. In our area, we've got significant challenges with high numbers of patients with safeguarding needs, and actually trying to process that workload effectively to both improve the quality of that care and also the speed of that care is something that we're mindful of. So creating a role that is specifically designed to support the practices without workload and engage with the patients so that they can understand and navigate hopefully some of this a little bit more effectively. It's definitely an MDT based role, and one that we are keen that is going to help to deliver better healthcare to our local population. And a few more things. Yeah, we're up to loads. So recently we've taken on a couple of health and wellbeing coaches who are looking at how they can engage with the local area, particularly in terms of the activity aspects of the gyms, the kind of the leisure centres and that kind of stuff, and encouraging the use of those for our patients. We're even contemplating how we can do that in care homes. So watch this space. We've hopefully got something really cool coming for that particular group of patients shortly. I'm a big fan of social media, and I find that it can help spread the message if it's done properly and effectively, and that's what this is in some way as well. So I'm coming to you live through the power of YouTube, and hopefully that's a useful mechanism to learn and share the various different pieces of information, and it's something that we were going to be continuing to do in the near future. And finally, as the last kind of resource that we've got, we're looking at how we can help support the mental health and well-being of our patients. In particular, we're really happy that one of our practices is working closely with their local church group to facilitate pastors coming in to help support patients in terms of looking at their mental health. This is a completely pastoral support network. It's something we're piloting, so we'll hopefully see the outcomes of that in the near future, but keen to see how that develops in terms of providing additional resources and services for our patients and things. So hopefully that's been a good summary of the various different aspects that we've been working towards, both in our local area and collaboratively with our neighbours and other organisations around us. We're really keen that this is something that hopefully can continue to develop, and we're looking forward to working with various other organisations to continue to deliver amazing healthcare better for our local population. I'm Dr Gandhi of Nottingham City East. Thank you very much.